Hi class, this is Alana and my gastrointestinal disease is gastritis. Gastritis is an inflammation of the lining of the stomach and it causes abdominal pain and like tummy aches. There are two types of gastritis. There's the acute, which means like you were stressed or you were sick and the lining of your stomach kind of swelled up and it's short term and it goes away. Or there's chronic, it means long term because you've done something to your stomach that's gonna affect the lining a lot more. The symptoms for both acute and chronic gastritis are the same, and they're just like stomach pain and ab pain, and then gas, and then even your feces can be dark, or you can vomit if your stomach gets that upset. The causes of acute and chronic gastritis, however, are a lot different. Gastritis is usually not genetic. It's more of like how you irritate your stomach and the ways that you can do that. Illness is a way to cause gastritis. Being sick and vomiting a lot can cause acid reflux, which then irritates the lining of your stomach. And then certain medicines too, like aspirin, that kind of bubble up in your stomach. And then there's a bacteria called H. pylori that causes indigestion and damages your stomach too. And that's one of the main bacteria in gastritis. Drug abuse is usually a cause of chronic gastritis because it's long-term drug abuse that kind of really messes up your stomach. Things like anything that you digest, like cocaine or just indigestible drugs, those are going to irritate your stomach a lot and corrode it. Over-the-counter drugs like aspirin can also corrode your stomach, and then drinking a lot of alcohol is going to put you at risk too. Stress can make you have acute or chronic gastritis depending on the level of the stress.
If you're only stressed for a short period of time, you're probably only going to have acute gastritis because you're only exposed to that risk factor for a short period of time. But if the stress lasts for a really long time, then that can become chronic because the stress on your stomach also lasts longer. Obviously, surgery or trauma that goes into your stomach and hurts it is also going to hurt the lining and the acid in the stomach. And so this usually causes acute gastritis. And once the healing process starts, it tends to go away. Now we're going to talk about who tends to be affected by gastritis. Anyone of any age who uses irritating stomach substances is at a higher risk of having gastritis, as well as people over 60. And both men and women are equally affected. Basically, the more you irritate your stomach, the more likely you are to be at risk for gastritis. Now we're going to talk about how doctors diagnose and treat gastritis. On the left of this picture is an endoscope, and they insert that down your esophagus into your stomach. And on the right side of the picture, you can see on top of the normal view of how your stomach lining is supposed to look and the path down to the stomach. And on the bottom is how gastritis is going to look. And it's really swollen up and just nasty. Another way they can test it is by testing your stool for blood. And if there's traces of blood, that's usually a sign that there's gastritis. The prognosis for gastritis is never really that bad. It's not permanently damaging in most cases. The only way is if you have chronic gastritis for a very long time, and that can lead to stomach ulcers if you don't treat it. There are different ways to treat gastritis. Taking antacids to start with is going to reduce the stomach acid you have that's destroying the lining of your tummy. Other more serious ways, if you have chronic gastritis, would be like Nexium, which helps calm down your stomach. If you're affected by the bacteria H. pylori, which can also cause gastritis, you're going to need an antibiotic. And then, obviously, if you stop using drugs that would hurt your stomach, like alcohol or just any of the drugs, you can help. Now we're going to go through our quick checks. So question number 1 would be, what is gastritis in general? I'm going to give you guys a few seconds to think about it. If you said an inflammation of the stomach because of irritation, bacteria, illness, or stress, then you are right. What bacteria causes gastritis? The answer for this one is H. pylori. Number 3 is, what is the difference between acute and chronic gastritis? Acute is short term and chronic is long term. Lastly, how can you diagnose gastritis? And the answer is either through an endoscope or through a stool sample, where they search for traces of blood. And this was Gastritis by me.